The Biden administration says it will start shipping coronavirus vaccines to retail pharmacies starting next week. About 1 million doses will go out. The move is meant to make the vaccine more accessible to the American public. On Monday, the CDC released new findings detailing disparities in the vaccine's distribution. The CDC says an estimated 13 million people received at least one dose in the first month of the United States vaccine rollout. According to its data, Black and Hispanic people were vaccinated at much lower rates than white people. Information about a person's race was only known for about half of vaccine recipients. Eugene Daniels reports for Politico that Vice President Kamala Harris is being called on to convince communities of color to get the vaccine. He says the goal is to, quote, spread awareness and boost confidence among a group of people who are also some of the most at risk of infection. And Eugene Daniels joins me now from Washington. He is a Politico White House correspondent and co-author of the Playbook Newsletter. Eugene, welcome. Thanks so much for joining us. So, your piece really kind of brings to mind this idea that when we're talking about this issue, there is so much wrapped up that has to do with American history, that has to do with inequities in these systems of healthcare. Let's start with this. What has Vice President Harris's role in convincing people to get the vaccine actually looked like so far? And how might it change in the coming weeks and months?
Yeah, officials that I've talked to in the White House say, this is a full court press, right? Vice President Kamala Harris is being sent out, but also we saw President Joe Biden get his vaccines publicly. They're talking about the second gentleman, the first lady, also doing things along with other members of the administration, but with the vice president being the first Black and brown person to be in that role, it's different, right? Like seeing President Biden getting his vaccine in public, it gives people some, a little bit of reassurance that, oh, if the president will get it, I will get it. However, as you said, there's this history of vaccine hesitancy because of the way the health industry has treated African Americans and brown people for years in this country. And so her role is a little bit different, right? She has to convince people who don't really want to get it. She's gotten both of her vaccines in public. The first she got in Southeast DC, which is one of the more poor and more Black and brown areas of the district. And at the second one, she got the one we're looking at right now at the NIH, where her mom used to go and work. So trying to create a personal connection and release the video. Someone I talked to in the administration said that everything is on the table, was the quote. So it could look very different. That includes, are there going to be town halls? How is she going to do this? Because it's very, very complicated because of that history.
So, something else that's so interesting is this concept of data and what it is they're able to tell about these vaccines. So the CDC says it only has race and ethnicity data for about half of the people who received shots between December 14th and January 14th. What have experts told you about how that lack of data impacts fixing this vaccine disparity that we're seeing? Because, it would seem to be kind of basic that in order to address some of these inequalities, you first need to actually know what these numbers are.
Yeah, the experts I talked to for the piece said that it's the most important part, right? If you don't know who is getting it, if you don't know where to go, we quoted a study in the piece that said about 17 states were releasing information on the vaccines based on ethnicity and race. And we have a lot more states than that in this country. And so it makes it really difficult for not just the Biden administration, but also state and local officials to figure out where to get these vaccines. We know and we've seen the issue with getting information on who was affected by COVID-19. And when the information started coming out, it became very clear that Black and brown people were disproportionately impacted for myriad reasons of getting COVID-19. And now the same thing is bearing out in the vaccination. And so when I talk to health experts, they say it was something they expected, right? They expected this to be true, but they're hoping that the administration is going to focus on kind of counteracting those things, because you can't just kind of throw out the vaccines and hope that it works out. They do have to be very specific and kind of work around some of those historic disparities in resources for Black and brown communities as well.
Right. Yeah, so your colleague David Lim was first to report that the Biden administration will start shipping some coronavirus vaccine doses directly to retail pharmacies starting next week. Eugene, how much could that impact vaccine racial disparity? Is that the administration's main goal with this move?
It's part of it, right? When I talk to experts, even some that worked in the White House on kind of these plans, they said that more vaccines is good. It's important that there just more vaccines out there. And so making sure that there are, this new program to ship them directly to pharmacies and kind of skip any kind of middleman is a good thing. However, all of the sources I talked to for the story, the doctors, Black and brown doctors and health experts, say that there is a lack of pharmacies and hospitals in Black and brown communities at times. And so something the administration is looking at doing is also having mobile vaccine units, right? And finding out where they should place those, and also focusing on local independent pharmacies. So not your CVS's, not your Walgreens, but the one that's in your county that your mom has always gone to and your dad always went to. And so this is an issue in rural communities and also Black and brown communities. So they're going to have to, because of their focus on equity when it comes to vaccines, it makes it a little bit more difficult. My source called it dynamic, but it does complicate how they're going to be able to do this, because there are all these different aspects of it that frankly haven't been done with the vaccine distribution up until now.
All right, it's a really important topic. Eugene Daniels. Eugene, thank you.
Thanks for having me.